All right, what do Peter Jennings, Nat King Cole, Walt Disney, John Wayne, what do they all have in common? Lung cancer, and they lost their battle with it. It can be such a frightening diagnosis for anyone to get, but as with all cancer, early detection is key. We want to talk about that. Some really exciting news here. Dr. Electra Kaloudis is a radiologist with the UConn Health Center. Good morning to you.
Good morning.
So first of all, who is most at risk for lung cancer?
Patients at the highest risk for lung cancer are patients usually over the age of 50 that have a significant smoking history.
Really, really important when it comes to lung cancer.
Extremely important.
To get early diagnosis, early detection, and early treatment. Why is that the case?
Lung cancer is the third most common cause of cancer overall behind prostate and breast cancer. However, the chance of death, or the survival rate, is actually much lower than even the two of those cancers combined.
So the point with this new screening program that you're here to talk about is because you want to catch it just as soon as possible, and that's going to give everybody the best chance, isn't it?
Exactly. Much like with breast and prostate, the earlier you catch the cancer, meaning if you catch the cancer while it's still in the lung, then the better your chance of survival. And I can spew numbers which can bore people to death. However, if the cancer hasn't gone anywhere and it's sitting as a little nodule in the lung, the 5-year survival rate is upwards of 90%, whereas if we are a little bit later in catching it, as unfortunately lung cancer tends to present very late, then the survival rate actually can go down to as low as 11% after 5 years.
All right, so this new screening program, how does it work?
So the person comes in, gives us a call at the lung cancer screening program that we've established, and our phone number is 860-677-LUNG. We call in and you would talk with our nurse navigator, Patty Ardolino, who would actually help facilitate you coming in, making your appointment, getting the order from your physician, bringing you in, meeting you, and talking with you about your smoking history. There are very particular patients that we're looking for in terms of the screening program, the ages between 55 and 74, current or former smoking. If you quit smoking, congratulations, but it has to have been done within 15 years, and people that have had what's called a 30-pack year smoking history. So patients that either smoke 1 pack a day over 30 years, 2 packs a day over 15 years, whatever the number of years you've been smoking times the number of packs per day, then that should equal 30. And so these are the patients that are considered at highest risk. So they come in for a very quick exam. It's a CAT scan of the chest that we have a very special protocol for that reduces the amount of radiation that they're exposed to. And it's very quick, it's easy, you're on the table, you're off the table, and your results are given to you within 20 minutes after completing your exam.
So it doesn't sound like it's with new equipment or anything, it's just a new approach to really catch this just as soon as possible, screen people who are most at risk, and get them to the right people and the right doctors and the right treatment just as soon as possible.
Exactly. And so if there are any findings, then again our nurse navigator helps navigate the patient through the very complex network of healthcare, essentially. And if there is nothing, which is what we hope to see, then the patient actually, we recommend that they come back every 12 months to come and get screened so we can catch it as early as possible.
Well, it's very encouraging, and when it comes to lung cancer, there's so much bad news. So this is great, encouraging news. Dr. Kaloudis, thank you, and again, the information's right there. The lung cancer screening program, if you want more information on this, or if you're interested in going through it yourself, 860-677-LUNG. This is at the UConn Health Center. Thanks again for bringing this, really appreciate it.
Thank you.